Hey, good morning. I'm Dr. Steve Stites, Chief Medical Officer here at the University of Kansas Health System. Welcome back to Open Mics with Dr. Stites and our monthly edition of Show Me the Science. Today, we're drawing a strange connection between Alzheimer's disease and, wait for it, hot tubs. Yes, you heard that. We're asking what hot tubs have to do with Alzheimer's. And here's a clue. It's in the heat. Inside a lab, next to some gym equipment and a bone density scanner, there are two rooms with regular store-bought hot tubs. Did you guys get them on sale at Sears? Where they come from? We'll have to talk about the source of the origin of this medical device here. They aren't for relaxing, though, in this case. They're for Alzheimer's research, which means research manager Casey John had to learn a thing or two about hot tub maintenance.
Like the pHs, so making sure our pH is in balance, alkalinity, and then we have some minerals that we put in it, bromine, to help with sanitation. It's just normal maintenance of a hot tub that you would have at your house. Probably a little bit more intensive than normal, but that's just a safety precaution.
You know, I'm just saying, the last time I got in a hot tub was at the hotel in Denver, Colorado, and they had too much bromine. That didn't feel good, but I bet our lab does a little better job than that. Research participant Arnie Aaron has taken part in previous exercise studies, but with a bad back, a nice warm dip was a refreshing change of pace.
I had lower back injuries. I play a lot of golf. I used to play baseball, fast pitch softball. I'm 76 years old, and my back is like 120 years old, it seems. And they said there was a study, and hot tub? And I said, that's crazy.
Yeah, well, it may sound crazy until you connect the dots between heat and metabolism and your brain. And to help us connect those dots, we're talking with these terrific folks. Dr. Jeff Burns is an expert in memory care and the co-director of the KU Alzheimer's Disease Research Center, also called the ADRC. We're always glad to have you on the program. Actually, this is kind of a welcome back. You've been on a couple times before. We're also joined by two physiologists and researchers working in the ADRC, Drs. Paige Geiger and Jill Morris. Welcome to the program, ladies. Are co-leading this particular hot tub study we're talking about today. And right off the bat, do any of you have any connections to the hot tub industry that we need to disclose?
Yeah.
No.
Do any of you even own a hot tub?
Working on it.
I heard a not yet on that one. I heard a not yet. Okay, well, let's start connecting some of these dots. Dr. Burns, what's the link between metabolism and brain health?
Yeah, so there's a very large scientific base that links metabolism with brain health. And so things like diabetes, which is a metabolic disease, is associated with Alzheimer's disease and brain health. But there's a lot of other things that point to links between brain health and metabolism. So for instance, we're interested in mitochondria, which are the powerhouse of the cell, and we think they may have something to do with Alzheimer's disease. And you know, a number of other things. These guys are the experts here, the metabolism experts in brain health. But a lot of links, and we've actually been focused on in this area for really the last 15 years, really trying to drive forward this idea that metabolism, along with all the other things we see with Alzheimer's disease, like the plaques and tangles that you hear about, but metabolism is part of the problem. And we think that if we can go after metabolism as a target, that we might be able to help people with Alzheimer's, maybe even slow or prevent the disease, and make that part of the sort of combination of things that we think it's going to require to stop Alzheimer's or prevent it.
Plaques and tangles. So if my thoughts are tangled or jumbled, does that mean I have tangles in my brain?
No, probably not.
Okay, my wife might differ. All right, Dr. Geiger, how does sitting in a hot tub impact your metabolism?
There's a growing body of research to suggest that sitting in a hot tub, or a sauna, can benefit a number of different metabolic factors. So improving blood glucose, improving blood pressure, lowering inflammation. And we didn't invent this idea. Actually, heat therapy is an ancient practice, from Roman baths to thermal spas in Scandinavian countries. This has been something that has been used for centuries. And in physiology, a number of people have studied the way the body responds to heat, understanding the maintenance of body temperature, whether it's in relation to performance or, say, military studies that need to think about people going into extreme environments. So a lot of that work has been done. in terms of understanding that thermal response. And really, it's just been the last 5 or 6 years that people are starting to look at that in response to health and disease. So a lot of these approaches have been tried and practiced, and we're just applying it to a new, prevention in metabolism and Alzheimer's disease.
It is kind of interesting. What's the mechanism, do you think, in their team? Any one of you, we'll start with you, Doctor. What's the mechanism between I heat my brain up and I have better outcomes for Alzheimer's?
Well, we think it's a lot of things. So I'll give you a comparison to exercise. So if you think about you're going to the gym, you get on a treadmill, and a couple of things start to happen. You're starting to work, you're starting to exercise, your body temperature is rising, you're starting to sweat, your heart rate is going up, your blood is getting redistributed to other parts of your body, to your muscles, and to your brain. And when you sit in a hot tub, you get a lot of those same responses. So we think there's some physiology that's shared between that sort of work of exercise and the work of being warmed up or heating. And it can go all from the gamut of lowering inflammation to improving the way that your muscles take up glucose. And hopefully something that we are interested in is what's the coordination between the way the body uses glucose and the way the brain uses glucose.
That is fascinating. So, Dr. Morris, some people have used the unofficial term type 3 diabetes. Help me understand what that means, and what does that mean in this case?
Sure. So many people are familiar with the term type 1 diabetes, which is characterized by the pancreas not producing enough insulin, and type 2 diabetes, where insulin is produced but it doesn't work as well. That's termed insulin resistance. Both of those are medically characterized terms where they're basically recognized as having elevated glucose levels in the blood or blood sugar. Type 3 diabetes is not a medically recognized diagnosis. It's really a concept where people have postulated that Alzheimer's disease is characterized by brain insulin resistance. And this is a really hard concept to prove. There's other groups that are out there looking at it. But our study is really focused on targeting those peripheral aspects of really type 2 diabetes, type 1 diabetes with this elevated blood sugar and hypertension that's a risk factor for Alzheimer's disease. Sort of getting at those root causes, and especially in cognitively healthy people before they start to have these changes occur to prevent Alzheimer's disease.
So that's fascinating. So some of the things we see in the rest of our bodies may be true inside our brain, and it may help lead to Alzheimer's.
It's possible.
Okay, so is the hot tub going to help solve that too?
That is what we're actively investigating, yes.
Excellent. Okay, so about this hot tub study, you're calling it Fight AD. Now, Dr. Morris, you're going to have to tell us what does that stand for. Maybe it's Fight AD. Correct me
Yep,
here.
it's Fight AD. You're right. Feasibility of improving glycemia to prevent AD is what it's called. So yeah, again, finding people who are at metabolic risk for Alzheimer's disease due to elevated blood glucose, elevated blood pressure, things like being a little bit overweight. Those are really common things in our society today that we think they can be addressed early and really be a way that we can improve brain health.
Okay, so talk to us a little bit, Dr. Geyer. What is a heat shock protein?
All right, let's get into the nitty-gritty of this.
I love it. All right, now we're getting cool here.
Okay,
or
so
hot, I guess, is it?
Heat shock proteins are a family of proteins that act like the cell defense system in the body.
Okay.
So they are responsive to heat, which is why they're
We're
named.
talking Chris Jones right now. This is defense. I got
Yes,
it. All right.
yes.
Now I'm
They're
track.
on the O-line, ready to defend the cells.
Okay.
So these heat shock proteins respond to heat, but they also respond to other changes that the cell might think are stressful, like changes in pH, for example. And so they're there to defend other proteins. And they're also sort of directors. They can talk to other proteins, and they can even talk to the mitochondria, as Dr. Burns mentioned, which are important for cellular metabolism. And so in terms of metabolism and Alzheimer's disease, what we think these heat shock proteins might be doing is sort of turning on a system of defense within the cells, whether it's in the periphery, whether it's in our blood, or potentially in the brain, to tell other proteins what to do, to tell proteins like amyloid that are impacted by Alzheimer's disease, perhaps to help them maintain their structure, or to signal the mitochondria that they need to activate and do more work for the brain.
That is. Go ahead. I heard you were going to say something.
Just to feed off what Paige said, I just think it's really fun because heat shock proteins are also called chaperone proteins, and you can think of it like a chaperone on a field trip with kids. They really keep other proteins in line, and they're really important for keeping proteostasis or homeostasis. And Alzheimer's disease is characterized by protein misfolding, so we're very interested in these mechanisms.
That's pretty fascinating stuff. Is there any way we can make this study easy, or is it because everything inside the brain is hard? Because the brain's hard to get to, right?
It is hard to get to, and it's hard to measure. Yeah, these kinds of outcomes. Are we improving brain health or not? That's kind of that's a hard thing to do, is to measure that. But this is, a great example of how we're thinking about metabolism in a lot of different ways, and trying to go after it with drugs, trying to go after it with exercise, diet, and now hot tub therapy.
Hot tub therapy or sauna therapy, as I heard. Yeah. Okay. So, who can participate in this study, folks?
Yeah, well, it's open to people who are cognitively healthy, so we actually have them go and see a clinician and we evaluate their cognitive performance. Then we're looking for people who have risk factors for metabolism deficits, so things like, again, hypertension, high blood sugar, high BMI, things like that.
And so do you care about age?
Yeah, we're enrolling individuals who are older adults, 65 and older.
Okay, so I'm almost there to qualify, but fortunately I don't have high blood pressure, but I already exercise a lot. But do you think that this hot tub therapy, what's your goal in this study? What are you trying to show?
Well, so one of the things people don't know very often about Alzheimer's disease is that type 2 diabetes is a major risk factor for Alzheimer's disease. And this is, that's my research area. My primary research area is metabolism and diabetes. And we know a lot about what is good and preventative for type 2 diabetes. And so exercise, diet, lifestyle interventions, as Dr. Burns mentioned, and also heat therapy, which can improve blood glucose, blood pressure, and potentially brain glucose metabolism, which is what we're looking for. And so we're after some of those modifiable risk factors that we know we can turn around and reverse potentially, or postpone longer in people that are at risk for Alzheimer's disease. And so really, this is the very first time that anyone is doing a clinical trial looking at heat therapy for Alzheimer's disease prevention. And we're really excited about what we might find in those connections between metabolism and the brain.
That is fascinating. So patients sit in a hot tub and you want to track their internal body temperature. So you ask them to swallow a thermometer. Now, in my mind, I grew up in the 60s, right? So a long time ago. I think of the long thermometers had a little mercury in the tip, but we're not swallowing those, right? Talk to us a little bit of what does it mean to swallow a thermometer?
Yeah, so we have these little temperature pills. They're about this size, a little smaller than a multivitamin. And you just take them like you would take any other pill, and we can actually measure core temperature. They work for a few days, and then they just pass on, and you take another one before the next bout of heat therapy.
Well, that's pretty cool. They connect to my phone with a Bluetooth device or something and send a little signal out. Is that what they're doing?
Yeah, we have a remote monitoring device.
Very nice. Yeah. Now, how are you tracking potential changes in the brain with that?
Well, that's a great question. So for the brain outcomes, we're again looking at brain glucose metabolism. So we're using FDG PET, and then we also have.
Okay, you can tell us all what that means.
So
that's one of those things that we're like, what?
We use a tracer that can actually measure how sugar is used in the brain. So this is a measure that we know declines over time with aging and especially with Alzheimer's disease. So the goal is to see whether improving peripheral blood sugar levels actually tracks with changes in brain glucose metabolism or brain sugar metabolism. We're also doing some MRI measures. We're looking at things like brain blood flow. We're looking at oxygen uptake efficiency in the brain, and just monitoring, some of those aspects.
And this is all before and after the hot tub or during the hot tub of some sort, right?
Yep, before and after our intervention, which is 10 weeks long.
All right, very interesting. Now, you can't do this research without people who are willing to participate, and I know the ADRC has done a great job of building a community full of people wanting to help. So what it's like working with all these good folks?
Oh, we've got great volunteers and a huge community of people who are part of our team and joining the studies and volunteering their time and effort. So it's been a great, we've been doing it now for almost 20 years, which is amazing. But yeah, we've built up a great community, and it is a community effort and a team effort, and we need we need people. We always need more. We need people joining the team and participating and helping us move the science forward.
And how do people enroll? If they're hearing this program, they want to enroll in this study, what do they need to do?
So you can contact the KU Alzheimer's Disease Research Center, and if you go to kumc.adrc.org/fight_AD. That's a mouthful, but we'll put the information up on the screen and either now or later. And reach out to anyone at the medical center and they can direct you towards the Alzheimer's Disease Research Center. We have a huge team of individuals that help us with the recruitment, and when we did this study initially as a pilot, we had a waiting list for people that wanted to be a part of this heat therapy, so we hope that interest continues, and we have lots of individuals that are willing to help us do this work.
Very cool. Dr. Morris, besides the hot tub study, what are some of the other questions you're researching under this umbrella of type 3 diabetes? Brain diabetes.
That's a great question. We know that the brain loves sugar, so we're very interested in fuels for the brain. I have some studies that are involved, or they're looking at exercise and how that affects brain fuel. We're very interested in lactate metabolism as being an alternative fuel for sugar in the brain and Alzheimer's disease. I know that there's other studies at the center that are looking at ketogenic diet and ketones as a potential alternative fuel. So there's a lot of really cool research going on right now.
That is amazing. Do you know if anyone is looking into these new GLP-1 drugs and how they might affect or impact brain health? GLP-1s like Wegovy and Ozempic.
Yeah. If that's directed to me, so I'd say there's a huge interest. I'll turn it over to you guys, but there's a really big interest in those drugs and that drive weight loss and reduce appetite, and actually may have more direct effects in the brain that we don't quite understand very well. But yeah, big interest, and there's actually we've got stuff locally interest, but nationally there's a big interest. And I'll say there is a late stage study, a phase 3 study of semaglutide, also known as Wegovy and Ozempic. That's should be done in about a year, I think, and it's in Alzheimer's disease. So we're really anxious to see that result and see, do these drugs have an impact on people with Alzheimer's?
What do you think the results can be, doctors?
That's a great question. I think that it's interesting because we're talking about prevention, so we're looking at people who have these metabolic risk factors. In Alzheimer's disease, the disease is already progressing, so it's hard to really tell in that situation whether or not they're going to have the same, the same impact.
The same thing. Okay. So, Dr. Burns, there's a new Alzheimer's drug awaiting approval from the FDA. Donanemab is not a cure, but it maybe slows progression. Talk to us a little bit about it.
Yeah, so the drug donanemab is being reviewed by the FDA. We were expecting it to be approved in January, and it's been delayed now twice, and we're not sure why. The data's really strong. The whole field expects it to be approved at some point, based on the data that suggests it does have an effect on slowing Alzheimer's disease progression. So we think it's being held up right now for sort of technical reasons around how it should be prescribed and monitored and all that. But it's a pretty exciting time. We have another drug like it called Leqembi that's approved, and we're actively prescribing it now to the sort of the right segment of patients who may benefit.
In the disease and people you think can really help slow. And donanemab, do you think it's going to be better than the others?
That's hard to know. I mean, it's hard. It's debatable. Some people think it may be a little bit better. There is one benefit. It's given every month as opposed to every 2 weeks. Versus the Leqembi's every 2 weeks, and this is every month. And so, there may be some benefits to it. We'll see. That'll kind of come out in the data. But it's a really exciting time to actually have new drugs for Alzheimer's disease. The conversation in clinic when we're seeing patients didn't change, at least for my first 20 years in the field, and it's now dramatically different. We have new drugs to go at to help people in the early stages who fit the profile. The drugs do come with some risks, so we have to be really careful how we prescribe it and who we prescribe it to. But for those patients, it does slow things down.
So Is the FDA going to have to put hot tubs through the ringer, and so to speak? That was supposed to be a joke. I don't think it came out very well. Or was it? Okay, never mind. All right, we're here to answer your questions, including my failed humor. Send them in using the info on your screen. That includes the chat on YouTube or Facebook or the X platform, or emailing the Medical News Network. Dr. Dana Hawkinson has the day off today. Who gave him the day off? Our COVID count, though, is down this week. Only 8 active inpatients. And actually, the influenza numbers are down. RSV is down. Spring is here. Thank goodness. One thing we'll want to have a conversation about, though, coming up, there is some early and emerging therapy that are data suggesting that dengue fever may become a greater risk in the southern United States with climate change. So something to think about. Next time Hawk and I are here together, we'll talk a little bit about the meaning of dengue fever. Jessica Lavelle is watching for questions from our community. Jess, I haven't seen you on this program in a long time. It's quite the honor. We're delighted to have you here this morning.
Good to see you.
Not that we don't love Alexis, but it's cool to see you again.
Thank you. Thanks for letting me come back on just for a moment. Okay, so Yenling is asking if soaking in hot springs to promote blood circulation could help alleviate the symptoms of Alzheimer's disease too.
Great question. So we're doing this in a very controlled environment in the laboratory, but there is reason to think that, you know, the use of these thermal springs and sauna and all these other approaches also can have a benefit. And in fact, there are some researchers that are doing muscle-specific heating. So using this, something called diathermy, which is used regularly in athletic training, where you can directly heat the muscle. And those studies have shown an improvement in mitochondrial function, and also an ability to prevent muscle atrophy, which is really exciting. So there are all kinds of new heat applications coming out all the time. This is a really growing and exciting field. And we don't yet know, is a hot bath warm enough? We don't know the answers to all that, and that's why we're doing the hard research, the randomized clinical trials, to really get at those answers so that we can tell people, here's how you can do this in your everyday life.
Yeah, that is pretty amazing, and you think about what this could mean. But I think about all those people who would go back in the 30s for TB, lung doctor, TB therapy, and go to those hot springs. Not sure that was the best use of the hot springs, TB therapy, and catching all those nice little tuberculi in the mist. But for something like this, that could be pretty cool, huh? All right, Jess.
If heat affects metabolism, what about cold?
Great question. This is a question I get a lot. You've probably seen a lot of things, people doing the cold plunges now, the polar bear plunge. This is not something new.
Chiefs Dolphins game in January.
Yeah, exactly. That's a different type of cold. Yeah, so
dumb cold.
I look at all of these environmental changes, whether it's heat or cold or exercise, as being sort of a stimulus for all these systems in our body that need to be used regularly, kind of like the car that sits in the garage and never gets utilized. All of these environmental changes are really good for just our overall health of the cellular systems that we're interested in. And it's possible that heat and cold do some similar things. So those heat shock proteins we talked about earlier, cold actually will activate them as well.
Okay, so this heat shock could also be a cold shock.
Potentially.
Yeah.
Although, which would you rather do? Get in one of those cold plunges or sit in the hot tub?
And I think the difference that we don't understand there is really the effects on the vascular system. So we might have some different vascular effects with cold therapy versus heat, but yes, as Paige mentioned, that response for the chaperone proteins would be.
So what I really hear you saying, Dr. Geiger, is you're not trying to talk your husband into a cold tub. Is that correct?
No, that's not what I'm interested in.
All right, Jess.
Another question is, does heat therapy offer benefits outside of brain health?
Ooh, okay. Well, I think that's a pretty good question. What do you think?
Yeah, that's a great question, and I would say, what we're trying to prove, it does have benefits on brain health, and I think we know, and I'll turn it back to these guys, that it does have effects outside of the brain, and that's probably what drives any brain health effects. But maybe you guys can talk about
Doctors.
Yeah, I think that our preliminary data and our pilot study showed really some trends towards vascular function effects. So it could really have an effect on cardiovascular risk factors and things like that, even before maybe our changes in glucose metabolism are seen. So I think that heat therapy for some of these other metabolic disorders might be worthwhile.
Yeah, so blood pressure, we know that the heat can improve blood pressure. I'm interested in its effects on pain as well through some other collaborative projects. And it makes sense, right? A lot of people will say they feel better after sitting in warm water or sitting in a warm bath, but we don't actually have the evidence to objectively say that it improves pain. And so that's something that I'm also very interested in. We know that it can improve markers of inflammation, which underscores a lot of different chronic diseases. So I think what's good for the body is good for the brain, and kind of that communication back and forth, I think heat is going to be effective in a lot of different areas of the body.
Fascinating. Okay. Jess.
Dr. Geiger, I know you touched on this, but Jean wants to know, would taking a hot shower or a hot bath do anything? Do we know?
We don't know exactly. That's something that we still need to understand. What is the minimal temperature? I would love to eventually get there. With our research right now, we are using water temperatures that we know will raise core body temperature about 1 degree. And so 1 degree Celsius. And so we think that that is sort of at the initial starting point, but I would love to see us work backwards from there, different body temperatures, and get to a maintenance system, really. I'd love to see heat sessions be incorporated with healthy diet, with exercise as, you know, preventative approaches. And I think getting towards you know, how can you do this at home? Is a warm bath enough? That's where we hope to get eventually.
You know, you could be a spokesman for the hot tub industry right there. I think they'd be like, oh, we're going to hire her. That's awesome.
I'm a believer.
Yeah, you are. So, you know, I would think that the jets and the way the water moves around you would do a better job of heating up than just sitting in hot water and waiting. Is that accurate?
We've never looked at anything like that.
Yeah, we have some people who prefer to sit in a hot tub with the jets going and some that don't. We let them choose, really. But again, we're monitoring that core body temperature the whole time. So we can kind of make some adjustments to make sure that they are within that window of. And that's actually another good question regarding the shower question, is how long will it take to actually get to that change in body temperature? Is a shower long enough for that?
Yeah.
So.
My wife would say that the length of my showers would suggest that I'm maybe under long enough. It's funny to think about the impact of thermal hot springs, and now we're trying to go back to the future, so to speak. Talk to us a little bit about some of that history that's back there. I mean, you guys must be kind of studied that a little bit.
A little bit. So we know that in Scandinavian countries, for example, there was a study out of Finland that showed that the more sessions of sauna individuals had per week was associated with a lower risk of dementia in those individuals, for example. And that's some information that really helped propel us to go into this direction.
Yeah. It is very interesting. All right, well, this has been a great discussion. I want to thank all of my awesome guests this morning who have had to put up with my bad humor. Final thought from each of you. Dr. Morris, we'll start with you.
Yeah, we're just really excited to kind of see where this takes us and be really among the first to quantify some of these changes in the brain. We're also going to look at some blood biomarkers. We have the benefit of being in a time where there have been great advances in our ability to measure brain outcomes just with blood draws. So, yeah, stay tuned.
All right. Dr. Geiger.
So I think that, you know, it's easy to say that exercise is it's the best medicine, right? But we know that there are so many patient populations or individuals that cannot exercise enough to get the benefits, say maybe due to an injury or due to advanced age. And so I think it's important to consider alternatives. And so we're really excited that heat therapy might be a good alternative for people that can't get to the benefits of exercise.
Yeah, that is pretty fascinating. Dr. Burns.
Yeah, I'd just say it's a really exciting time for Alzheimer's disease research and sort of this focus on brain health. We've got new drugs. We talked a little bit about that. We got blood measures that are coming online in terms of helping us diagnose and spot risk. And then we have lots of things going after the disease. And this is a great example of sort of the variety and diversity of approaches that we're taking and that we're going to need to stop Alzheimer's. So exciting time.
That is pretty exciting. I remember the last time you were on the program, you brought a test that we could do at home to kind of test your cognitive function as a screening test. Of course, I went home. I did my screening test. I passed, by the way.
Good.
Took a little help, but I did pass. And now it means I'm going to have to go look at a hot tub again. My wife will shoot me. All right. Thanks, everyone, for watching and listening. You know, one of the cool things about this program is we try and open up our hearts and our minds to new ideas and new thoughts. But at the end of the day, what we're really trying to do, whether we're talking back in the midst of COVID, of using the rules of infection prevention and control. We're talking about hot tub therapy. What we're really talking about is how to make sure you take care of yourself. And we know that that intersection of faith, and faith in each other and faith in science, hope to wait for a better day, and then science can really help deliver some really amazing answers. And when you think about it, with all the challenges around aging in the United States and throughout the world, and with Alzheimer's disease, the importance of faith, hope, and science, and maybe of hot tubs. Thanks all. We'll see you again next week.
I remember camping at the lake, a sudden searing chest pain that came out of nowhere. Bounding out of the camper, I cried for help.
That chest pain wound up being a tear in a major artery. I'm Alexis Del Cid. On the next All Things Heart, meet the woman who survived a potentially deadly condition and see how she's inspiring others.
Subscribe to our morning medical update and Open Mics with Dr. Stites podcasts. Now, everywhere podcasts are available.